Given Uganda's undeveloped public transport system, Boda Boda transport is the swift and quickest means of transport many Ugandans use across the country. Many prefer these motorcycles due to ability to beat traffic jam and accessing remote areas that have poor roads. This has seen many riders fail to follow traffic rules, like riding on the wrong lane, riding on road shoulders, pedestrian walks, building verandas, overspeeding, among others, which often lead to accidents.
Tubadde tutya mu ddwaliro lwansonga nti bw'oba ogenze mu ddwaliro ng'ofunye accident tuba tulina ekintu kiri kimu nga kye tulina mu birowoozo batugamba batemako amagulu kasaba olya nti ofunye accident ng'ogenze Mulago.
Kuba abamu bagamba nti owa boda boda omuteerako emmere ng'omaze mulaba ng'akomyewo. Bakyala baffe batugamba naye nga kituwa enkyukwe mu mutima ne tutya. Buli lw'oyingire kubona omanya nti ogenda kumenyeka, ogenda kufa.
It's against this background that the doctors under the Association of Surgeons of Uganda have organized a specialized training with the selected riders. These have been trained in several accident response and rescue measures like first aid.
Actually, we are all victims. We all use motorcycles once in a while, or we are all passing by them, we are sharing roads with them. So we are all victims. So we decided to come on board as the Association of Surgeons of Uganda to help the motorists know the dangers and the consequences of their reckless driving.
The doctors have denied accusations that they ampute legs of Boda Boda accident victims without a second thought. Dr. Michael Setabi, a surgeon at Mulago Hospital, says it's always the decision of the patient to have their legs amputed.
Every patient is considered individually and not the profession they have. So we assess you and we find out the reasons as to why the limb can no longer be useful. It could be a nuisance, debilitated limb that needs to be removed. Okay? And no limb can be removed without explaining clearly to the patient and getting consent from the patient. Some patients refuse to have their limbs removed, so we give them time until they understand. As probably the limb is rotting away, they'll understand why we are telling them that we can no longer save the limb.
The training is meant to counter the ever-increasing road accidents, especially involving Boda Boda riders. Dr. Kigonya says each individual has a role to play.
We have shared with them some statistics concerning road use and motorcycle riding, and the person from emergency medicine actually gave them some tips on how to do first aid, how to stop bleeding, what to do in case an accident happens on the road. He has helped them know what to do, how to transport the patient, where the patient must go.
The training has been under the theme Naja kukola si kufa, literally meaning I came to work, not to die.